Let's start the test.
Hi and welcome, let's have some fun. We're going to do some eye test that you can do at home to check up on your eyes. It gives valuable information on how your eyes are doing. The tests include world first unique test for glaucoma and cataracts on your mobile phone. We will first do some necessary pre-tests before glaucoma and cataracts test. First test, color contrast and sensitivity test. Use both eyes and wear any corrective lenses or glasses you normally use for clear vision. Pick which one out of the 10 colors that is different from the rest. Okay, the last one was really difficult. How did you do? I hope you managed to level 3. Good job. Sometimes if patients have an optic nerve issue, they mention that colors don't seem as vibrant. The reason for this can be multiple sclerosis or CMS. Sometimes patients are undiagnosed with CMS and complains about pain with eye movements and blurry vision in one eye. They also mention that colors almost seemed great and that red color sometimes looks pink. What color do you see now? Red is the correct answer.
This is what's called an astigmatic dial. If you wear glasses, go ahead and take them off. What you want to do is cover one eye at a time. Let's start by covering our right eye. You want to stare right at the center of the circle. All the lines radiate outwards, kind of like spokes on a wheel. How does it look to you? Are all the lines sharp and clear? Is there a certain section of lines that appear more gray or out of focus? Which lines appear more clear to you? Okay, so now let's cover the left eye and try it again. How do all the lines look? Nice and sharp? Are there certain lines that are a little bit more fuzzy? If you notice that some of the lines were more clear, but other ones were more blurry, then that might be a sign that you have astigmatism. So what's astigmatism? Basically, the cornea or the front of the eye is normally round like a ball, but in some people, the shape is more oval, like an egg. If the shape of your cornea looks kind of like an egg sitting up, that's what we call against the rule astigmatism. But if it looks more like an egg on its side, then that's what we call with the rule astigmatism. Patients with the rule astigmatism will see that the vertical lines are sharper and the horizontal lines are more fuzzy. While patients with against the rule astigmatism will see that the horizontal lines are more clear and the vertical lines are more blurry. How did you do?
We will now do a color blind test. 1 in 12 men and 1 in 200 women are color blind. Are you one of them? Let's find out if you have normal color vision.
What's called the Ishihara color vision test. For this test, you'll want to cover one eye at a time. Let's start by covering our right eye. Okay, so what number do you see here? Try to remember it. Okay, what about this one? We'll also remember this one. Okay, what about this one? What number do you see? And last one, do you see any numbers here or no? Okay, so let's check your results. For the first one, you should have seen the number 74. For the second one, the correct number was 97. For number 3, the correct number was 16. And for the last one, there shouldn't be any numbers there. If you couldn't see any of the first 2 numbers, or if the last plate you saw the number 73, then you probably have some form of color blindness, so definitely go get that checked out. You can also go back and repeat this test on the other eye if you want to double check. Okay, this one is called an AMSLER grid, and this is a common test we use to screen for macular degeneration. How this test works is you cover one eye at a time and stare at the center of the grid. All the lines should be straight and uniform. You shouldn't see any areas that are blurred or blacked out. Those are called scotomas and may be a sign of a vision problem. The other worrisome sign is if the lines appear wavy or as if they're underwater. This is called metamorphopsia and may be a sign that you have swelling in your retina from wet macular degeneration. You can look at the AMSLER grid first with your right eye covered. Then take a look with your left eye covered. Are all the lines nice and straight and sharp? Okay, I hope you find these vision tests fun and interesting. Just a quick disclaimer, these vision tests do not in any way replace a comprehensive eye exam with your eye doctor. The tests and examinations we do in the office are much more precise and accurate in diagnosing eye conditions. But some of these at-home tests are still really useful screening tools that you can do in the comfort of your own home.
Next test is a glaucoma test. Please share and like this video so many people can get access to these helpful tests. These tests can give early warning of health problems with your eyes. Before we do the glaucoma eye test, let's take a brief moment to understand glaucoma, a condition that affects the optic nerve and can cause blindness.
A clear fluid flows through the anterior segment at the front of the eye, nourishing tissues. At the open angle where the cornea and iris meet, the fluid flows through a spongy meshwork and leaves the eye. But if it passes through too slowly, pressure inside the eye rises to a level that damages the optic nerve, resulting in vision loss due to open-angle glaucoma. Untreated, the vision loss progresses from normal vision and no pain to gradual loss of peripheral or side vision and eventually total vision loss.
This one is called a visual field test. We perform this test very commonly in patients with glaucoma. That's because in glaucoma, the peripheral vision can get damaged. So we can measure the health of your peripheral vision by doing a visual field test. How these visual field tests work is you cover one eye. Let's start by covering our right eye and look at the target in the center of the screen. It's important that you keep your eye focused on that central target. You don't want to move your eye all over the place because if you move your eye around, then we're not really sure we're testing your peripheral vision anymore. And so as you're staring centrally, the test will flash small lights in your peripheral vision. Now, it depends on how close you are to your screen, but you basically want to make this video test nice and big in your visual field, so you might have to get a little bit closer to your screen. In the office, you'd press a button whenever you see the flashes, but for this home test, let's have you count how many flashes you see. Let's start. How many lights did you see? If you saw 11, you got them all. You can also try the same test with your other eye. Okay.
We will now do the world first test for cataracts on YouTube.
This test is only for information purposes and cannot replace comprehensive cataract testing performed by an eye care professional.
We start to do the test on the left eye. Cover the right eye. What number do you see? We start with easy level and finish very difficult level. How did it go? Don't forget to do the same test on the other eye. I will now explain the result. If a person struggles to identify patterns at higher contrast levels 1 to 5, it may indicate severe visual impairment and the possibility of cataracts or other significant eye conditions. Difficulty identifying patterns at lower contrast levels 6 to 10 can indicate milder visual impairments but still suggest the need for a professional eye examination.